Hello.
Hello. All right. So, super excited tonight. I probably have had more calls and questions and texts about tonight's little webinar that we're doing. Super excited to welcome Dr. George Gertner. And you're just outside of New York City. And Dr. Larry, pronounce your last name for me.
Arbeitman.
Yeah. Just because I'm dyslexic and I didn't want to hack it. So Dr.
Nobody
Larry,
gets
Dr.
it right
George.
the first time.
So these two guys have been buddies for how long? 18 years, 20 years?
20 years. He was a student clinician when I got to life, and he was practicing on my spine.
Oh, I love it. Friends for
I'm
life.
sorry.
Friends for life from life.
Yeah.
And so, yeah, you guys studied upper cervical at Life. Did you work under
Russell
Grostic?
Friedman. Russell Friedman.
Russell Friedman.
Yeah.
And that's awesome. You guys, Dr. Larry, you're in New Jersey, and you guys have busy clinics already. You guys have both been very successful. Dr. George, you see, I don't know, how many a week right now?
We're getting up there again, right around 350 or so.
And it's just yourself, or do you have a whole team?
In the transition, I have a couple associates part-time, and I'm hiring. So if you know somebody who's looking for working a all cash upper cervical practice doing software therapy, let them know.
I'm 5 miles from Life University. I'll check with Dr. Danielle Pichette. She's the upper cervical queen over there. And Dr. Larry, you're in Jersey, and how many do you see per week?
About 450.
Oh, okay. Sleeper guys. I like that. And you guys know that we love working with chiropractors that have been around for 15, 20 years because, first off, they have a wonderful database that they can always use for referral sources. And then secondly, most chiropractors, their bodies are breaking down because they're doing diversified. Dr. Larry and Dr. George, they've kind of preserved their bodies over the last few years. So, but you're still, those are big numbers that we don't see every day in clinics. So Dr. Shannon introduced this to you. How did she approach you, and what did she say that got you excited? I'll start with Dr. George because he put his order in first.
Yeah. Shannon called me up and she started telling me about this new thing. And I've never done therapy before, just like Larry. In the 20 years of practice, the philosophy didn't jive with you. I'm just straight up a cervical, or very principle based and healing from the inside out. We never adjusted a bone besides the atlas in 20 years. So it doesn't come any more pure than that. And I just love the philosophy that we've always had. And I've never done anything else besides upper cervical. I put ice on people sometimes. And Shannon called me up and she told me all about it. She told me all the amazing, and it almost seemed too good to be true, honestly. Like, I've known Shannon for a long time and I trust her 100%. And I actually bought this thing without even seeing it ever. I didn't even know how it worked. And the first time I saw it was came in my office. And she told me about the results, and she told me about like money. She was doing really well with it financially, helping a lot of people, transitioning chiropractic to software and back and forth. It just seemed like a great model. And after speaking to her, I was all in. I called Larry up and done.
Yeah. So then you told Larry, and Larry, it was at the end of the year after the holidays. You were somewhat on vacation, but yeah. I think before you left, you're like, I'm putting my deposit in now. And so you had not seen it either. So yeah, what's your story? Similar.
Yeah. So I just do whatever George does. He's never steered me wrong. No, same deal. Shannon had been talking to me about it for like 6 months, 12 months. And I just been like, nah, I'm not going to do that. And then she started sending the text messages of the before and after videos, and they were powerful. And leap of faith, it made sense. I said, okay, let's do it. But what was really confirmational for me after the fact, and I was doing my research, I'm a big analytical researcher, I found out that Dr. Curtis Martin, Joel Tages, Louisa Cohn, Duncan McCullum, these are all doctors I've known, Scott Kramer. I've known these doctors for 7-8 years. They were all straight chiropractors. and have all been using the unit. And I found that out after I put my purchase order in, and I was like, whoa, these guys are top shelf chiropractors. If they're rolling with it, this thing is right. And I'm just really glad. I'm excited to get going.
You've already got your device this week, correct? Or coming in?
I got it this week, and we have our launch day this Saturday. Dr. Shannon's coming out to New Jersey.
So tell me, you had some pretty cool numbers lined up already. Can you share what you've done?
Yeah, we were really enthusiastic about our launch, made the banners and the materials, and we're talking it up, and we have 22 patients scheduled for Saturday morning from 9 o'clock to 2 o'clock every 15 minutes. And we have a waiting list of 40.
Wow. Waiting list practice. That's amazing. Those are great numbers. Now,
because we have one unit and we're already a very busy practice. So I'm like, where am I going to put all these people? And so we just have to do it like a soft launch, no pun intended.
But to be honest, that, supply and demand comes into play right here. And now I see why George said that you would probably beat his numbers. So number one, thanks for having faith. I get that it's too good to be true so much of the time from so many different doctors. And we almost have to dial it back when we're explaining because we get so excited about it. And, I call it the Semmelweis effect. We all remember Dr. Semmelweis, Ignazio Semmelweis, Hungarian-born physician who basically was practicing in Vienna. And in 1956, I believe, he made at an international medical symposium, he said, I believe that we should wash our hands from going from the morgue to deliver babies. And they ridiculed him. They yelled at him. And they said, how dare you? We're the highest educated people on the planet. And sure enough, he was run out of the profession. He died, unfortunately, in a psychiatric asylum. But medicine went on to claim it as their own, and that's usually what happens a lot of times. So thanks for taking the leap of faith. Dr. George, I'm going to have you step up for a minute. You actually did something very similar. I mean, you guys coached with Dr. Curtis Martin. You did a few calls with him prior. And so walk me through what did you do to kind of excite your team and your community and your existing patient database?
Well, for months we were waiting for this thing. So we had an opportunity to talk it up to all the staff and first of the staff, but then also the patients. And way before we even had it, the patients were going bananas. They couldn't wait to hear about it. And I was just talking up, and we had a list of like 75 people waiting for this thing. And it's just like, it was just unbelievable. And can you see me?
Yes.
Oh, because I lost your picture. Oh, there you go. All right. I'm sorry. We lost your volume.
Yeah. So.
Oh, but so anyway, yeah, we talked it up, and it got really exciting. And when it hit the ground, we hit the ground running. I mean, we had it with Curtis Martin. He just gave us some advice on just some ideas and to structure day one, day two. He told us about just the verbiage, how to talk about it. And I mean, it's so easy. I mean, the procedure and the device, it just works on its own. And once people started getting better, they started telling everybody in the practice. It really exploded. It's unbelievable.
5 years ago this month is when I came across it. And, I always say it starts with one, and there's power of just small steps. Right. And I realized it was the best thing that I'd seen in 23 years of healthcare at the time. And after running the functional medicine and rehab department of Life University, I had $250,000 worth of rehab equipment, and nothing fixed my wrist. 3 treatments in basically a 10-day period, 90% resolution. I bought a device, and I didn't have to treat my wrist for 14 months. So awesome. So you basically did 35,000 in pre-sales?
No. we've done a lot more than that.
But so break down. He basically, Dr. George paid this off in 9 days, 9 business days from the time he got it. Walk us through the numbers.
So each week we charge $300 a session, and I've talked to people that charge less. Why would you charge less? I mean, we have such an amazing thing in hospitals. Like I think Hospital Special Surgery and Sloan Kettering, I think they have this. They don't charge 180 or 300. I bet they charge you $2,000. So we can charge whatever we want. So we charge $300, which is totally fair. I charge $100 for an upper cervical adjustment. A 3-minute adjustment is $100. So they're here for 12 to 15 minutes for $300 is a bargain. So we price it the way it should be. I price 300 times 10. We give them 20% off if they prepay, which everybody does. Nobody prepays. And I actually have 3 options. I have 10 visits for $2,400. When I do 20 visits, it's 25% off, so that's $4,500. Then I have, like, whenever you sell something, you should sell three choices. You have the medium Coke, the large Coke, and then a supersized, ridiculous Coke in the movie theater that nobody else is going to ever buy. So I have a 60 visit plan. The 60 visits, $18,000. No one's going to buy that. I actually had one person buy it. I did have one person buy it because she loves to spend a lot of money in the office. It makes you feel good about spending a lot of money. So, and we have a huge number of 18,000. It's 12,600 because it's 30% off on that. When they see that big number, and then they see 2,400, it's nothing. It's just by comparison. So there's 3 options. They see so I sold mostly all 2,400 options, a couple 45 and one 12.6. So we give them 3 options, and nobody balks. Not one person says it's too much money. Not one person. Now, they're all like, wow.
Let me just say a couple things, and I'm probably the Mother Teresa in the Softwave community. And when I started 5 years ago, nobody knew what the hell. They thought I was crazy. They thought they looked like I was coming from Mars. Okay. So I wanted to lower the bar, right? The $49, $79 introductory offer, whatever you do. I wanted people to have access to this. The secret weapon here is that we find out within 10 minutes if these patients are candidates. Would you agree?
Yeah.
So for us, and we do 125, 140 new patients a month. We are not in, you're on the outskirts of New York City. So you're in a little higher price zip code. Your clientele is a little higher. And don't think everyone can do this, right? And again, this is not about how much money we can make. This is really about how many more people we can help. And that's it.
Absolutely.
And the beautiful thing about this is you're going to get referrals from other doctors and their failures because you have this device. So again, the pricing, I don't care. I really don't care what people do. I feel that you need a level of certainty before you start playing in the big leagues. You've already have 20 years in chiropractic, which is awesome. And we're out in Beverly Hills and they're charging $600 and $900 for a session.
Wow.
So you're right. You're still at a good price. And the beautiful thing is, you plant the seeds with these patients. One of the keys I tell every single training we do is, because I'll say, Mrs. Smith, today's your first visit. We're going to find out if you're a candidate for this. The cool thing about this is when we run this over normal tissue, no pain, as soon as we get to a bad area of inflammation, arthritis, torn ligament, poor circulation, there's a biofeedback component where you're going to say right there. Oh, and we're going to be able to pinpoint where that is. So that part is really cool. And I would guesstimate 75 to 90% of the people notice a difference after that first session. They can move their arm better, they can walk. Videotaping and documenting that is key, especially for you to be able to keep sharing this in your community. But one of the things we say to Mrs. Grandma Smith is, hey, Grandma, Miss Smith, if we help you, all we ask is you tell 2 or 3 other people about this because it's too good to be kept a secret. And they're like, oh, they don't think they're going to be helped because they've been to doctor after doctor. They're skeptical too. And what's beautiful is once they do see a great change and they're walking around and I'm like, hey, Miss Smith, don't forget our deal. What's that? You're going to tell other people, oh yeah, my bridge partner and this and that. So always plant those seeds. You're going to exceed their expectations 90% of the time, but also creating attainable results and goals. So after a couple of weeks, what are some great stories that you've seen in your clinic? I know Dr. Marco came up and trained. Give me some little insights on, we saw some of them that you posted as well.
Yeah, so it's really been unbelievable, the results. We had the first 39 patients. We saw 39 patients in how many days? We were all the way through, what's it, 10 days now? 30, and 37 out of 39 felt at least a little something better. One felt nothing. It was just crazy. When I got this thing, I was very skeptical. I knew that it was going to be effective for certain things, and I knew that it was going to have some results, but nothing close to what it's been. This has blown me away in every single way. It really has exceeded my expectations. So, I mean, we've had people, one lady's supposed to have knee surgery, one treatment. She's like, well, I don't think I feel any better. Then she stood up, she's like, oh my God, my knee doesn't hurt. Like, it just, they're almost befuddled because they can't imagine what it's like to not have the pain they've had for 25 years in 10 minutes. People can't walk, and all of a sudden one guy couldn't walk. I put a video on there, and all of a sudden he's walking like a normal person. 10 minutes later, it's mind-blowing.
So that's such a great story and testament. And, you know, the proof's in the pudding. We always say that. And the patients are so wowed. Yeah, I don't necessarily do it. I'd probably say 50-70% of the people on this call don't do a 2-day. So, I mean, I like to capture the emotions at that time. Tell me, walk me through what you say after that first visit. How do you prep them for the second day?
Well, you know what? I trained to do a 2-day, but then the first
You didn't
day,
have to do 2 days, did you?
No, I didn't. No, not at all. And I don't. I do, and within chiropractic, I do. The chiropractic, I do a 3-day actually, but for this, I was training on doing a 2-day, and then after like the 5th person, she got up, she's like, holy shit, she was like blown away. She's like, you know what, whatever this costs, I'm ready to go. And I was like, all right, I'm ready to go too. And then I did it, and just like that, she threw a credit card at me, $2,400, and then I did another, and another, and another, and I did 7 in a row, just like that on the first day. I mean, it was just, there's no reason to do 2 days when you can do it all at once. Maybe a 2-day might be better, and I'm just guessing, is if all my patients right now are active patients that know me, like me, trust me, they've gotten good results already, so they're ready to go anyway. They've already given me $5,000 for their chiropractic care, so $2,400 isn't a lot when they've already trust me. So someone off the street, I get an ad off Facebook, it may require more leverage.
We'll have to have Dr. Steve Gumpenberger. He's one of my favorite docs. There's 578 doctors now with this technology. Wow. Think about that. And that's really in the last 33 months, the bulk of patients. Like, this is, we call it the soft wave tsunami. This is coming. And by the way, Liz Keener and Laura sent out the survey, the soft wave survey results. I hope everybody got a chance to see these, because we're going to review them today. I'll probably have a whole 35 minutes on this. So this is a great way. When we had 273 respondents out of 400 people, that's pretty badass. It was close to 67%. Dr. Gumpenberger has a 91% case acceptance for his existing patients, and patients off the street, he's at 87%.
Wow.
Conversion.
Wow.
That's the best I've seen in 5 years. And yes, your patients already trust you, love you, and respect what your recommendations are going to be. You'll see how you gain instant credibility with these patients with that introductory offer. And then once they're sitting there and you've melted away 10 years of scar tissue and they're moving their arm right, then they're like, what else do I do? You know? So let's thank you so much. The fact that you've been able to do 9 to 10 days is just a testament of how user-friendly this is and how it works. And the takeaway point is this: take no credit, take no blame. This is so much bigger than just one or two people. And collectively, we are really going to change healthcare from mediocre to good, right? Because you can't go from good to great. You have to go from bad to good first, and then good to great. And when we have 11,000 of these across the country, and 80% of them will be in chiropractors' hands, we will be really making a difference and an impact, an eternal impact on healthcare system. And mark my words, I'm making these bold predictions. Dr. Tina's got a question. I'm going to give 2 seconds, and then I'll be right with you. So effectiveness, and this is from your doctors. For chronic pain, 88% noted soft wave therapy is very effective or effective. 88%. For acute pain, 85% felt it was very effective to effective. Again, use this. We should print this out, put it in your clinic. Initial treatment protocol of visits for a single area of complaint. It's at 6 to 8 visits. We found, let's see, 31 and 52 is 83% of the time you're only using 8 sessions to get these people to their optimal results. That's pretty good. Average number of pulses is between 500 and 700 soft waves. Remember this, for some of you new docs, any soft waves that aren't causing some pain and discomfort are wasted. So when I first started on 5 years ago, the Hertz was at 4. When I went to the UFC on Tuesday, they were at 6. See, they are used to using a radial device that's this ballistic little hammer. So I'm waiting to come in, I'm checking in, and in the background I hear this machine gun. I'm like, that's our soft wave? Because I'd never heard it at 6 Hertz, like coming so fast. And so when I got back there and I started the training, first thing I did is put it to 2.5. I said, hey, why did you have this at 6? And they're like, oh, because we use the radial device and we just thought that those settings would work here. They're not. This is a genuine lithotripsy. The other one is a radial pulsed acoustic device. Total patient.
So can I ask a question?
Yes, sir.
So I usually, we're talking about the frequency we're talking about, right?
Yeah.
So I kept it at 2 usually. Did you say it's better?
2.5 is found. 2.0 for men's and women's sexual health, but 2.5 is really great for orthopedic, fascia, soft tissue,
Really? I didn't know
even
that.
organs. Okay.
So I should do 2.5. It should bump it
Go
up.
to 2.5. Yep. And
Okay.
then Tina, I'm going to ask you to unmute and you go ahead and ask your question.
Thank you. I think I have 2 or 3 of them. They go together though. So I'm also an upper cervical chiropractor. I've been in practice 26 years. My machine's on its way. So and I also charge $100 an office visit. So I kind of liked your discussion of how you were coming up with your fees. One of my questions was, can you tell us a little bit more about the scripting and conversation you had with your patients leading up to booking that first appointment? I would like to know what that sounded like a little bit.
Table talk.
Is that for me?
That's for you.
Okay.
I just basically say it's the most amazing thing. I've done this for 20 years of chiropractic. I've never seen anything quite like it. And it's a high velocity sound wave that goes right into the area where it's affected. If there's scar tissue, arthritis, adhesions, inflammation, it goes in there. And just like you mentioned earlier, if there's everything is healthy, it goes right through there and you don't feel anything, and it starts to break up those problem areas. And after that, that's the first thing it does, is make you feel good because the inflammation starts to disappear. But then the true benefit is the stem cells, laying down the stem cells and regenerating the tissues. I just say it's a TRT, tissue regenerative therapy, and it's the best thing out there. And they also explain briefly that there's other types of stem cells, and I tell them the pricing for that and how like some may be painful. I try and show them the difference, and it's a real simple, and it's a conversation I have with my patients. And again, they want something. These people are eager to have this technology.
You're right. I mean, people are sick and tired of having drugs thrown at them, risk of accidental overdose, cortisone injections. This is the time is ripe right now. And again, I've made this prediction 3 or 4 years ago. not in 127 years, has chiropractic really embraced more than 10, 12% of the population. Would you agree? So this is really the Trojan horse for more people living in pain and chronic issues to come into your clinic. And again, they don't care what the last two letters at the end of your name are or what type of doctor you are. They want the relief that they saw on that social media. Last thing, and we can answer some more questions. I see.
One thing I like to say too is I explained that the philosophy is what it aligns with what we do, because it's really healing from the inside out. I've never done therapy because that's outside in. You put biofreeze on something, it doesn't do anything. You just feel good temporarily. This is a healing from the inside out, and people they really love that the way that all works.
That great point. And I always loved above, down, inside out. From a structural standpoint, being a CVP doctor, I love the above, down, inside out structure, working on the spine. But I never felt like the real inside of the cellular, like activating your body's own stem cells, resident stem cells, progenitor cells, vascular endothelial growth factor, like all these things that happen. Oh, by the way, everybody that's on tonight, May 3rd, which I think is next Tuesday, we're scheduled to interview Dr. Johannes Holfeld. He's the cardiac surgeon who's been one of our main researchers in the soft wave world for 14 years. He took it from hypothesis of Nicholas Hoffenfeld, who's one of our German counterparts, and John Warlick, and they took their hypothesis, and over 14 years, he's performed 60 bypass surgeries, and then used our patented technology right over the heart, getting 11% improvement in ejection fraction, and even 1 year later, it's a stable improvement. We've never seen anything like this on the planet ever, anything called cardiac regenerative type treatments. So this is huge. A couple final things. Again, we had 667% of respondents that of our providers responded. 78% are chiropractors. The remaining were surgeons, physical therapists, podiatrists, osteopaths, urologists, occupational therapists, acupuncturists, naturopathic doctors. 91 of the respondents, this was the first time using any type of shockwave device. 72% of you use this daily. 71% said the device is easy to use. And then from the marketing standpoint, let's see, 10% have been using this for 3 years. 18% have been using it for 1 to 2 years. And then 60% have been using it for less than a year. And so you can see the growth and how it's been working. The effectiveness is huge. And then last thing I wanted to check, most of the marketing, 64% of new patients were coming from marketing, social media and digital media. 38% said testimonial videos were most effective. They love 12% love the educational videos. So things like that. It's like, I say it all the time. No one's going to believe you unless you document it. So if someone walks in with a limp, guess what? Hey, Mrs. Jones, do you mind if I get you kind of getting out of that chair and walking into the treatment room one more time? Oh yeah, sure. Because we're gonna take another picture when you're done. We're gonna see it. We're gonna compare them side by side. So we'll videotape it. You need 10, 12 seconds of the actual treatment time, because people, when they see this, they've never seen soft wave before and they don't know what it is. And then you get them actually walking up off the table in the first few steps and see what they do, right? You did that, correct, George, when you did your videos?
Yes. Oh, absolutely, right. Yeah.
And so now you can use those videos in your ads, and they're real people with accents, just like, not that you have an accent, Dr. George, but you do. And your surrounding area will be like, oh, this is legit. This is these guys from Yonkers. You know what I mean? So important to understand that. Dr. Larry, anything to jump in? I'm checking questions over here.
Yeah, I just think you know, especially when you're talking to your own patients, they trust you. You have their trust, and you get excited about it. We talk about how it's gonna help reduce inflammation, stimulate stem cells. We're not putting anything into the body or taking anything out of the body. It's a fraction of the cost, and now you're on the tissue regeneration ladder. So you're getting on into that regenerative healthcare ladder without any of the expenses or invasiveness. And they don't want cortisone shots. And as upper cervical doctors, you know, people have knees and shoulders and ankles and feet, and you know, we don't really touch them, you know. And of course, many of them can be affected, but a lot of them need that innate healing response stimulated. And I think it's a perfect marriage. And I think what's gonna, you know, you talk about the Trojan horse. I think it's really important as more and more chiropractors use this technology, that what's going to differentiate from us from the you know, other professions is that we're going to provide chiropractic care along with this, and our results are going to be that much better.
Yeah, removing a mechanical stress to a dysfunction joint will only help speed it. And again, wherever else have you ever seen a device that we have an innate immune response, right? The first responders of toll-like receptor 3 and, you know, TLR4 and, you know, the interleukin team, that they're all responding to this. Like when you want to talk about innate, like BJ Palmer would be using this, folks, guarantee it.
Yeah, I think so.
He spoke to me. No, remember, be the turtle in this race. This isn't, you know, one hit wonder, 2 weeks. You know, I'm looking for the next shiny thing. You guys never put in a therapy in your clinic before. That brings joy to my heart that you found that this aligns with our chiropractic philosophy, right? Taking something like some type of biological fluid that costs $1,200 and injecting and hoping for some miraculous results. It's a roll of the dice. There are certain consultants that have been chiropractors for 40 plus years that want to tell you, set up a medical discipline, multidisciplined office, hire a medical director for $1,500, hire a nurse practitioner for $80 to $90 an hour, and then buy $1,200 worth of this fluid, whatever, and inject it in the patient and hope for a good outcome. It does not align with our philosophy, right? So I say you've got to make these recommendations like you're making them to your family member, the people that are in your community, right? You've been there long enough. So it's really good. Guys, change never happens really quickly. And the people that are on this call, it's really all about, you know, one more step as we move this, right? I call it the Peloton, right? John Warlick was riding his bike all by himself, and then I found him 5 years ago. And now we have nearly 600 doctors in this Peloton, and, you know, we're cutting through the wind and making it more effective to bring this treatment to more people. Dr. Steve Miner has a question. Why don't you unmute? And then I'll answer the questions that are coming up. Dr. Eddie Hall, good to see you, brother. I'll answer that.
Hey, Dr. Matt, how's it going?
Hi, Steve. Dr. Steve is in Austin. Can't wait for this. Steve, are you an upper? No, you're not an upper cervical though, right?
I'm not. I'm diversified.
Okay, go ahead.
Just curious to know how many shock waves the doctor's using when he's charging $300 per session.
So what we usually do, we do 500 for a certain body part. And then say we're doing low back, sometimes we'll do the feet or we'll do the hands, like so reflexology points. And we're getting some really good results with that. And sometimes it was a big back, we'll do like 800 just on the back area. So between usually 800.
So that's good. Yeah, we can break down the pricing on that and show you. I typically on these calls, we don't really talk about pricing, but I wanted to show you how you got to these numbers and how you were able to pay this off in 9 days. And it's definitely worth chatting about. I'm just going to get a couple of the write-in messages here. Let's see. Eddie, where's your question? Dr. Eddie, any idea if this would help with ADI, brain injuries leading to progressive memory loss? Alzheimer's, dementia, is that what you're saying, Eddie?
So, so we have a patient, her husband had a pretty traumatic fall, and he had an axonal injury, obviously. So his memory is gradually decreasing to the point where he's long-term memory is not that great. Short-term memory is hit or miss. But I read some of the things you guys did in the past with the, dementia and that type of situation. I just didn't know, because she asked me about it, and I wasn't sure or confident enough to really give her a straight answer. So I told her I would ask you guys what you guys thought. Yeah,
great question. And this is obviously, this technology has now been approved in all of Europe for working with dementia and Alzheimer's patients. So that's the number one, right? Have we been approved here in the States? No. For like a traumatic brain injury, like what that gentleman suffered, you have to be very careful that there's no damage to the arteries. So oftentimes you want to see a recent MRA that shows there's no bleeding within those arteries. Okay. There's a compassion form that I can talk to Liz Keener about having shared. Because we have asked the FDA for emergency use authorization, that has not been approved. So anybody that's working on the brain, you better have a compassion form signed, filled out. I don't even care if it's your parents, because you don't want a sibling to say, oh my God, the damage, they don't know what you're doing. They don't understand this technology. So you have to have a compassion form. Dr. Michael Putman made it famous and, worked on John, who's probably our first Alzheimer's patient that we actually got to interview, which was amazing. Like, you meet cancer survivors every day, but you'd never meet an Alzheimer's survivor. They all die. And it's a terrible way to die. I lost my mom to it. John Warlick lost his dad to it. This is dear to our heart, but we don't want to put the cart in front of the horse. We want to protect your licenses. We want to be compliant, right? We don't want to give a black eye to SoftWave as we're going through this process for class 2 clearance for activation of stem cells and working with burns and ulcers and wounds. I mean, these things are huge. So great question. I'll keep you posted. Eddie, you can work directly with me, private message me. We can check those MRIs and MRAs. Okay.
Let me just follow up real quick. So if it's seen success in Alzheimer's dementia, I mean, because it's not going to be the same amount of plaquing. So odds are probably not going to be a great fit. Just because I know I'm going to see them again next week, right? And I guess I can message you as well, but
I mean, listen, I mean, this is his choice. He's still conscious, right? And we can,
of course, yeah.
I have no problem getting on the phone and talking to him and talking about the risks and other things. But again, this is FDA labels this as a non-significant risk factor. There's minimal side effects. How many times have we done the brain? Not a ton. So you got to be careful. You're in uncharted waters.
I'll reach out to you on a different LinkedIn
Perfect.
And kind of see where we're at. Thanks.
You got it. Yeah, we can share with you the pricing. That's not hard. Maybe Dr. George will send me that sheet and we'll post it on this event posting. This is from Dr. Rachel. What are they if with treatments with Alzheimer's? I don't know why that's all come up tonight. I mean, did we talk about Alzheimer's a lot? I don't know, but I will tell you this, the UFC, they're going to help us develop, they have some wonderful concussion protocols. We're going to be utilizing this device think about how many times these guys get hit in the head, right? I mean, hundreds of punches per fight. And so, they're unlike the NFL that doesn't really want to talk about it. I think the thing that I was so impressed with what Dana White has built there in the UFC is that they share all their stuff, right? They're working with the LA Raiders team physicians. They're working with the Golden Knights. It's the professional hockey team. They're They're collaborating. I've never seen this in a city. The Dallas Cowboys don't share shit with anybody else. Miami Dolphins keep, things amongst themselves. I mean, these are a lot of proprietary things that they're doing. So it was pretty cool to see what a collaborative effort that 3 major sporting teams were sharing amongst themselves. So I feel like, if you think about tau and traumatic encephalitis type of injuries, it's injury after injury. There's inflammation, there's plaque, even in a hematoma, so these are things that we have to, I say in the next 18 months to 2 years, are probably the most important thing on SofWave's radar. Let me see, I got Dr. Misty Paul. You can only come on if you show yourself. All right, there you go. Hi, Dr. Paul. Always good to have you. Question.
Thank you. I have a couple of questions. So last week, we talked about the amount of pressure that we use, and I know that there's providers that are using a lot less pressure. Is there,
when you say pressure, let's clarify. Are you saying less energy, less soft waves, less frequency? So remember, frequency is how fast it's coming.
Less
what?
Intensity.
Energy level.
Yes.
Okay. So what have you heard?
So I've heard both things. I've heard bring it up to a higher, the patient some amount of discomfort. And then I've also heard, well, no, take it down. Is it more of a couple of sessions, the introductory session, we're trying to determine where the tissue that's injured, and then after that, we bring the energy level down?
Great question. Yeah, I mean, what I do is unless the person's 95 pounds, I'm usually at an energy level 9 or 10, 90% of the time. If I'm at a knee, I might start at a 9 and go to a 10 for the last. Remember, if you're at 2.5 hertz, that's how fast it's coming. 100 soft waves, and I want you guys to start calling them soft waves, because shock waves are something totally different. But so 100 soft waves is about 1 minute, takes about 60 seconds.
Right.
So yes, during that first 60 to 120 to 20 seconds, I'm, at that energy level 9, I'm maybe hovering over those hot spots or trigger points for 3 to 4 seconds, but I might go up to 10 for the last 100 to 200 soft waves and see how they do. And sometimes I'll even start on 10 and I'll stop halfway and I'll say, do you think this is normal or abnormal tissue or joint? And they'll go, oh, it's abnormal. Okay. All right. So what I'm going to do, Ms. Smith, now is I'm going to turn this level, the energy level, down to more of a healing mode. And we're going to start your first treatment. The diagnostic part's over. Now we're going to start the healing. Oh, okay. Boom, 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 boom. Okay. So you can lower it. And if you can hover over those spots for 10 to 12 seconds, thank you, Crystal Hembrick, who's one of our national trainers who taught me that 4.5 years ago. If you can hover over those for a longer period of time, you have a better outcome. But also, I think where you got confused is when I talked about a wonderful acupuncturist, Dr. Weena. And yes, so she turns it down to 6 or 7 so that she can stand on those hot spots for 15, 20 seconds.
Got it.
Okay, so there's everything works. The protocol that we have in 580 clinics across the country right now is the less is more. This is powerful, intelligent energy, and you have to deliver it in small microdose ways and see how the body reacts, because not everybody's going to react the same way. This is where your practical knowledge and your specialized knowledge of how the body works and how patients react and heal comes into play. So there's no cookie cutter.
Got it.
Pretty close, but it's no kick. Let me see else. Tunja Webster, a wonderful RN who's in the research process. If the waves are not causing discomfort, that is healthy tissue. That's correct. Pain equals inflammation, decreased blood flow. And yes, you want to come back, right? Healing takes time. And what you're going to hear from Dr. Holfeld is a really cool concept. Healing has an endpoint. You know, when you cut your hand and it heals and the scar's up and scabs, and then when the scab falls up, guess what? It's done. Your body can go work on another area. And think about that. When you're working, you're not, that was one of the things that it's tough. Like patients come in, I got a shoulder, I got an elbow, I got a knee. You do not want to shed your 33% of your healing cells and repair cells to 3 different areas. You want to localize and focus on one chief area for at least the first 3 visits. And then you can start adding secondary and tertiary. That's right. You got it down, Miss Webster. Very nice. Jeremy Maxwell. Stem cell injections don't create angiogenesis. You're right. Ours does. That's a huge difference. Good point. Anyone using this for neuro? Yes. That's why I got it. I'll work on you a little bit more. Who was that? They've got a funny, their logo there. I'm not sure. Hey, Doc, my buddy had his hip replacement, has been getting soft waves since operation. And 1.5 weeks later, his surgeon asked him on his follow-up, where his bruising was at, because it was gone. And 3 weeks later, he was back to adjusting again. That's amazing. This accelerates the body's natural healing ability. Great story. I wonder how we can save that. Thank you. That's it. We went a little long. Dr. George, Dr. Larry, so awesome to have you guys on the team. We say this a lot, right? Rising tides raises all ships. You know, I can take us this far. Dr. George, Dr. Curtis, Dr. Scott Kramer, Dr. Misty, Dr. Eddie Hall, everybody is going to raise this. And I think that's the coolest thing. It's about a collaborative effort. Take no credit, take no blame. Don't get a big head with this. This is hard to stay focused. This is the body's innate ability. And that's what this intelligent energy is doing as well. When you power it with an adjustment, it magnifies the body's healing ability. Okay, I think that's it. I'm super excited. Thanks to all for coming. We had a nice turnout. Any final questions? Dr. Tina, I can't wait to come get an adjustment, knee chest adjustment out in Temecula. Thank you all. Peace and love. This Tuesday, we're going to have Dr. Holfeld. You guys can email me any questions. This guy is a researcher. He's the one who really discovered the toll-like receptor 3. So this is huge, and I hope everything goes well. He's got twins, and they're newborns, so we're hoping that it still works out, okay? Thank you all.
Thank you. Awesome.